Hello, social media family. My name is Dr. Rosemonda Boaje, and welcome to the third trimester. So, in this trimester of pregnancy, your scan, if it's routine, will be checking for the general well being of both baby and mother. For the baby, first of all, you want to assess the baby's size. Is the baby growing normally? Is he growing too small? Is she too big? What are the reasons for why the baby is not gaining weight or why the baby is growing too much? Sometimes when the belly is very big, what happens is that the liquor or fluid around the baby is too much. Or when you measure the abdomen is too small, and it may be because the fluid around the baby is too small. And so one of the other things we do in the third trimester is to measure how much fluid is around the baby. We also want to know the presentation. Is the baby lying longitudinal or transverse? If it is transverse, we don't like it. And if it is longitudinal, the head must be down. That is the cephalic position. If it is breech in the third trimester, we are worried, and we may repeat the scan very close to your delivery around 36 weeks to check if it is still breech. Because if it is, then it means that you are most likely going to get a cesarean delivery. In the third trimester, one of the other things we look at as well is the placenta. What is the location of the placenta? Is it lying so low that the baby will not be able to go past it to be delivered vaginally? And if that is the case, then we'll have to make provision for a cesarean delivery. If the mother has fibroids in this last stage of the pregnancy, you want to evaluate the position of the fibroid vis-a-vis the baby's presenting part, usually the head. Will the baby be able to go past the fibroids and be delivered vaginally? Would we need to go in to have a cesarean because the fibroids are blocking the way? These are some of the questions that we'll answer in your third trimester scan. We'll evaluate the mother's cervix, we'll look at her ovaries and any other pelvic abnormality that she may have. We want to check on those. If you have had a previous cesarean section, your doctor may be thinking about having the vaginal delivery for you this time. So in this last trimester, we are going to evaluate the weight of the baby. And depending on the weight we get, we decide whether it is safe for you to try vaginal delivery or if you are going to head straight out to have a cesarean section. If you go past your date and you have still not delivered, the question is, are we going to have an induction for you? You need to have a scan to measure several parameters, including the weight of the baby, the presentation, how much fluid, how the heartbeat is looking like. All these have to be factored in before the decision as to the mode of delivery is taken. If unfortunately you develop any complications, including but not limited to trauma, road traffic accident, a fall, if you are bleeding, if you are having pain, we would need to look at the baby. Why are you bleeding? Is it a placenta previa, that is the placenta being too low? Is it that you have an abruption? That means the placenta is beginning to separate too quickly. Any form of complication related to you as a mother or to the baby, we may need to look at how the baby is faring. Sometimes we just want to look at the baby's positioning and tone. Is the baby breathing normally? Is he or she moving their limbs? The scan gives us invaluable information as to how your baby is doing. Sometimes getting close to your delivery, you don't feel the fetal movement so well. You need to take a look and see what is happening to the baby. And so, if you are in your third trimester and your obstetrician asks you to come for a scan, these are several of the things you'll be looking out for. If you are pregnant, I wish you an amazing journey through this period. If you are hoping to be pregnant, I hope that God answers your prayer soon. And if you have already finished having children, or if you don't intend to have children, this information is knowledge that would empower you to be able to teach others as and when their need arises. Thank you for choosing Ranch. Thank you for listening to this podcast. God bless us